How is the world of professional sports handling the coronavirus? Let's bring in Bruce Arthur from the Toronto Star. Good morning, Bruce.
Good morning, Dave.
So I'm seeing that the NCAA is seriously debating canceling March Madness, or at least leaving fans out of the stands. There was a story the other day about how San Jose may be playing to an empty arena for their hockey team. Things are changing, and they're changing quite quickly.
By the time this conversation ends between us, if it lasts between 10 and 15 minutes, I wouldn't be surprised if 5 or 6 more things happen. Right now, Dr. Anthony Fauci is testifying in front of the House Committee for Oversight, and I can't remember the rest of it. And one of the things he said is he would recommend against, he's the head of the National Institute for Health in the United States. He said, I would recommend that we not have large gatherings, and if that means the NBA plays without fans, so be it. The dynamic so far has been smaller events have canceled first, or events in harder hit areas. So Serie A soccer in Italy, as part of they postponed games for a month. First they had no fans, then they had no games for a month. Then they shut down movement within the entire country, except in the cases of work, emergency, and health. So that happened really fast. We've seen lots of littler things happen, a lot of smaller events up to and including Indian Wells, where 60% of the population in Palm Springs is over 60. That's a significant risk group for the novel coronavirus. What's happening last is the biggest stuff. And so that means the NHL, the NBA, Major League Baseball, the NCAA, and eventually the IOC and the Olympics. What I've been told from people who have some familiarity with the way the leagues are thinking is that there seems to be no appetite to shut down unless mandated by government. And that's why you've seen what you've seen. When Santa Clara County recommended that they not have gatherings over 1,000 people, which, by the way, is a very arbitrary measure. I've talked to epidemiologists who say, they don't have a number for how many people is safe in an epidemic. The San Jose Sharks played anyway. That was the game after the Toronto Maple Leafs, and I was there. The Santa Clara County then banned the bigger gatherings. There has been a recommendation in Ohio from the governor there saying we would prefer you not play. The Columbus Blue Jackets said we're going to play. So what happened today with Dr. Anthony Fauci, I don't think that's going to change anything. It's a recommendation. The leagues right now are engaged in as much pursuit of short-term profit as they can before the government shuts down their arenas. And that's as simply as I can put it, and it's still changing incredibly fast.
Does that scare you?
It does. Okay, here's I'm not an epidemiologist, I'm not a pandemic expert, but here's what I know. By the time you have significant outbreaks in your community, it's too late to stop an outbreak in your community. If you look at Italy, on February 27th, they had 650 cases. As of yesterday, they were over 10,000. Right now, the United States has 1,000 and has barely tested anybody. So they have no idea what the problem is. So that's one of the issues that pro sports is having. They're waiting for a government mandate. The government doesn't have data as to how bad this is in the United States. In Canada, we have a slightly better handle on it seems like. But even then, I don't think we can have a handle on it. The first incidence of community transmission in Ontario was discovered yesterday. It was a gentleman who went to a mining conference in Toronto attended by the Prime Minister and the Premier of Ontario, Doug Ford, and there were 23,000 people there. But that's 19,000 people at the Leafs game last night.
Yeah, and 20-odd thousand at the Habs game last night, another 20,000 at the Big O for the Impact game.
Well, and this is happening, I understand why sports leagues are doing this. I think they need to get fans out of the arenas right now. Right now. If you want, I understand, the measures they have undertaken are to protect their athletes, and I understand that. Because if one athlete tests positive for the coronavirus, I'm told that the expectation in the NBA, at least not the final policy, but an expectation, is that if one player tests positive, it's a 2-week quarantine for the entire team, which means I'm not clear on how you can safely have a playoffs in any sport right now, in the next month. We're talking about, forget March Madness. I think that's going to go fast. And my guess is the NCAA goes first on this stuff. Because you have schools sending kids home right now. You have UCLA and USC and other schools taking fans out of arenas. But every time there is a game right now, the public health implications could be massive, because what you have is you have 20,000 people in relatively close proximity. They are standing together in line. They're sitting together in the stands. They are going to the bathroom. They are eating food. That is happening. The odds that nobody in that building has the coronavirus are going down every day. And again, the true scale of the problem in the United States is completely unknown. They had, as of 2 days ago, tested 8,000 people in a nation of 336 million. South Korea is testing 10,000 people a day. All the stories about the failures of the CDC and early testing are starting to add up. They're not sure if they're actually going to be able to have the material to have adequate testing across the United States. What you've seen in Italy and what you've seen in China is they went on essentially a war footing, extraordinary measures. And once you've lost the first window to identify and contain cases, because think about what happens in something like Ebola or what happened to SARS. You figure out who's got it. You figure out who they came into contact with. You isolate them. You test them. You try to stop the virus from spreading, right? You put it in a balloon, basically. That's gone now in the United States. And it may be gone in Canada to a degree.
A couple of minutes left. Sorry, I just want to reset. A couple of minutes left with Bruce Arthur from the Toronto Star. And Bruce, I don't know if you saw, but Governor Jay Inslee in Washington announced no public gatherings over 250 people. I keep thinking about the Mariners opening day being right around the corner.
Oh, this is going to happen everywhere. But again, going back to the original point.
Yeah.
In terms of what sports is doing right now, the only thing I think that is going to stop them from having fans in the stands is local government. That's it. And so you've seen it in Washington State. You've seen it in Santa Clara County. You're going to see it, I would guess, in Ohio. There are outbreaks happening in Massachusetts and in New York City. This is going to happen on a patchwork basis very quickly. And again, my reading right now from talking to people who know is the leagues are trying to squeeze as many dollars out as they can before they're forced to shut down. And if they wanted to be leaders in terms of public health, if they had any thought beyond their own self-interested profit margins, they would be taking fans out of arenas right now, but they're not.
Bruce, thank you. I'll let you know we just had some breaking news while we were in conversation. Harvey Weinstein sentenced to 23 years in prison.
Well, there's still some good news in the world, Dave, isn't there?
Thank you very much, Bruce. Always appreciate it.
You bet, Dave.
All right. That's Bruce Arthur from the Toronto Star with something that I don't think a lot of us want to hear, but I would think twice about going into a mass public gathering right now. I would think twice even more in a couple of weeks. Ball's in your court, Evenko.